Making sense of IVF treatment. One of the problems with IVF treatment is that patients still don't understand what the process involves. Not only doctors love complexifying the process so that they can charge more for it, there are also many myths and misconceptions floating around, both online and in the real world, that they don't know whom to trust. Most of them assume that it's too complicated for them to understand and are happy to leave everything up to their doctor. This is why they are very vulnerable, and it's easy for unscrupulous doctors to take them for a ride by using tons of jargon and using this as a pretext to charge more for every additional service they offer, most of which are not needed at all. Sadly, patients can't push back because they are so clueless about the process. All you need to understand is that IVF is just the final common pathway which doctors can use in order to help you have a baby. It's a solution which allows us to bypass all the problems which can cause infertility. The good news is that once you get pregnant after IVF, it's like any other pregnancy. Think about it this way. Normally, the egg and the sperm fertilize and form an embryo in the fallopian tube when fertile couples have sex in the bedroom. This embryo reaches the uterus after 5 days and it then implants in the uterine lining. Now, any problem in the bedroom, either with the sperms or the eggs or the tubes, can prevent this from happening and cause infertility. In IVF, we fertilize the eggs with the sperm in the test tube so that the embryo then spends 5 days in the test tube instead of the fallopian tube. After 5 days, we transfer the blastocyst back into the uterus, and if it implants, this is exactly like a normal pregnancy. You can download the IVF comic book free at the below mentioned website.